Joining us now, Dr. Deborah Birx, coordinator of the White House Coronavirus Task Force. Doctor, welcome to Fox News Sunday.
Thank you.
Where are we with the virus? Are we past the peak? Are we down on the downslope now? And given that just a few days ago the White House was projecting 60,000 fatalities and we're already up to 66,000, how many more fatalities should we expect in this country?
Well, first, let me start with our projections have always been between 100 and 240,000 American lives lost, and that's with full mitigation and us learning from each other of how to social distance. Every single metro area and every single outbreak across the country is different. And so whereas New Orleans and now Detroit and some of our other metros are showing a significant decline, others are just reaching steady state. We are encouraged that the New York and New Jersey metro areas are starting to see a decline after a long, flat curve.
As we said, about half the states, more than half the states, have started in some way, shape, or form reopening. But we've crunched the numbers, Doctor, and not a single state has met the White House gating guidelines of 2 weeks of steady decline in new cases. Are you concerned about this patchwork reopening? And why leave it up to the governors? Why not set a firm, if not binding, a firm national policy on when states can reopen?
Well, I think federal guidelines are a pretty firm policy of what we think is important from a public health standpoint. We also made it possible for states to open counties independently of the entire state because, again, some of these outbreaks are very local and have to be studied and understood that way. And so as states reopen, we really want them to follow the gating criteria, but we also made it very clear to the American people, this is what you need to continue to do to protect yourself. You need to continue to social distance. You need to continue to practice scrupulous hand washing. You need to know where your hands and where they have been and what they have touched and make sure you don't touch your face. And I think most importantly, if you have any pre-existing condition, through phase 1 and phase 2 of any reopening, we have asked you to continue to shelter in place. We know who's at particular risk for a very difficult course with this virus, and we cannot emphasize enough how strongly we feel if you have a coexisting condition to continue to shelter in place.
But clearly, when you leave it up to individual governors and governors are not observing the 2-week decline before they open, that sends a very mixed message to a lot of those individuals you're talking about appealing to. I want to play something that Dr. Anthony Fauci, your colleague on the task force, said this week. Here it is.
We give the governors the opportunity to be very flexible, but you have to have the core principles of the guidelines. You can't just leap over things and get into a situation where you're really tempting a rebound.
Do you share Dr. Fauci's guidelines about this patchwork reopening, that some governors, some states are jumping the guidelines and risk a rebound?
We made it very clear that the guidelines are based on very strong evidence and data, and that is the way Dr. Fauci is also driven. We want to make sure that every individual, every employer, and every person knows how to keep themselves safe in this situation. We've made it clear what the gating criteria is, and we've asked every governor, because I know they're also concerned about every single person in their state, we've asked every governor to post on their website and on a dashboard where exactly they are in the gating criteria, but also to make all the information available to the public and to have sites, sophisticated sites like Florida does and many other, like Massachusetts does, so people can see where the virus is in their community, because an educated community can really take action to understand how to protect themselves.
Well, let's talk about how educated some of the communities are. I want to do a lightning round. Quick questions, quick answers about some of the activities that people are engaging in around the country. First of all, California, where this past week thousands of people were massing on beaches in very close quarters. Simple question, is that safe?
If it's done with social distancing, yes. If it's not done with social distancing, no.
Well, I don't know that you can see the video. There was no social distancing, which is one of the reasons the governor shut those beaches. All right, let's talk about a different issue, because we're seeing a lot of governors opening up things like beauty salons and spas where people come into very close contact. You're getting a haircut, you're getting a massage with each other. Question, if both sides, both parties are wearing masks, is that safe?
It's safer, but we've made it clear that that is not a good phase one activity, and I think the president's made that clear when he discussed the case in Georgia.
Well, you know that's happening all over the country right now. Let me ask you about one more activity. Big crowds of protesters that went into the Michigan state capitol without masks, massing together in close quarters. I'm not asking you about their First Amendment right to protest. That, of course, they have. But from a public health standpoint, is that safe?
It's devastatingly worrisome to me personally, because if they go home and infect their grandmother or their grandfather who has a comorbid condition and they have a serious or an unfortunate outcome, they will feel guilty for the rest of our lives. So we need to protect each other at the same time we're voicing our discontent.
Let's talk about remdesivir. The FDA gave emergency approval to use of this drug to help people who have the virus. Is it a silver bullet in terms of reducing lethality, keeping people from dying, and also in terms of side effects?
Well, first, it's only half the data, and the Data Safety Monitoring Board, an independent group, thought that the improvement was compelling enough and significantly enough to actually say that they couldn't continue the trial as it was, and the placebo arm had to receive the effective drug. So it's a first step forward. In parallel, we have a whole series of therapeutics, including plasma and also monoclonal antibodies being worked through. We are concentrating on vaccines as well as therapeutic bridges to ensure that the American people can do well with this virus eventually. We really want to ensure there's both therapeutics available and vaccines available rapidly.
Then there's Operation Warpspeed, which is the Trump administration's effort to try to develop a vaccine by next January. Now, you and Dr. Fauci have talked sort of the rule of thumb is 12 months to 18 months. That would be considerably shorter than that timetable. Next January, is that realistic?
The way that is possible is if you bring forward 5 or 6 different classes of candidates, which the Operation Warp Speed has done. And so it's not relying on a single vaccine platform. It's relying on several different candidates that are made differently and act differently. And then it's about doing compressed phase 1, phase 2, phase 3 trials in an overlapping way, moving forward when you have a good safety and immunogenicity data, but not with the level of pauses that are often present in vaccine development. And so on paper, it's possible. It's whether we can execute around the globe, because you also, for phase 3, have to have active viral transmission in a community in order to study its efficacy.
Finally, Doctor, and I got about a minute left, there is a new report out of Australia this weekend that 5 intelligence agencies, including the U.S., have put together a dossier that indicates that the Chinese government in the early stages either hid or covered up the fact of the coronavirus and its spread in Japan. I'm not going to ask you to comment in any way on intelligence, but from a public health standpoint, did the lack of transparency from China in the early days, in January, February, even into March, did that slow down the public health response in this country?
Wherever that first jump occurs, whether it's from animal to human or lab to human, it doesn't really matter. Wherever that happens, you have to over-communicate, because that's when you get the first instance of how transmittable this virus is. What are the people that it's particularly susceptible to? That didn't happen, and it didn't happen until late, and it didn't happen until mid-January that they even talked about human-to-human transmission. And that really, and when you see how many countries now are infected, that did fan the virus across the globe.
Dr. Birx, thank you. Thanks for your time during these very busy days, and Doctor, please come back.